I'd like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past, present and emerging. Good afternoon, everyone, and welcome to the March FightMND Scientific Seminar. My name is Dr. Sarah Bennett, and I'm the Senior Research Coordinator at FightMND. We hold these seminars monthly on the last Tuesday of the month, and last month in February, we heard from Dr. Anne Hogden from the University of New South Wales. Dr. Hogden spoke about her research in developing decision-making tools for MND patients and their families. If you missed out on her talk but would like to hear about this, it is available to view on our website or YouTube channel now. So following the talk today, we are leaving plenty of time for discussion and questions. So if you would like to ask anything, please use the reaction button to raise your hand, and one of our team will enable your microphone and camera and let you know to ask your question. Alternatively, you can also type your question into the chat where our team will be monitoring and read out questions on your behalf. Please note that the chat function is only enabled if you're using the app-based version of Teams and unfortunately doesn't work if you're currently on the web-based version. Please make sure you introduce yourself and where you're from before asking your questions so that we can all get to know each other. So now to our speakers for today. We have a little bit of a different seminar for you today. We're swapping a data-heavy scientific seminar for a seminar all about data in research and the resources available that may help you enhance data utilisation in your research projects. Joining us today, we have Amini Gudavosos and Richard Ferrers, representing the Australian Research Data Commons. I won't spoil too much of their presentation in my introduction, but the ARDC is an Australian government initiative in place to drive national digital research infrastructure and support Australian research through a competitive data advantage. Through a number of initiatives, the ARDC is there to support you in your data journey, and Amini and Richard are here with us today to give us a taste of some of these initiatives that are particularly relevant to the MND field. Please join me in thanking them for making the time to speak to us today, and over to you.
Thanks, Sarah. So these slides are available on these links here. We've got a short link, eResearch with a .ch and then MND 2025. You can follow along those at that URL, and we've also created a reference document there, tools for medical. So I might just give you a few seconds. If we encourage you to open that document on your device, and then you can move backwards and forwards through the slides and click on any links that might be of interest. And maybe somebody could post that in the chat as well so that people can catch it up later. We'd also like to acknowledge the First Australians on whose traditional lands we meet, and where Armani and I are based in Melbourne, it's the Kulin Nations. A way that you hear these acknowledgements often, and one of the ways we like to make it practical is to encourage you to read the Uluru Statement. So if you click on that link, Uluru link there, you can have a look at it. It's very short but very beautiful about what the Indigenous people want from Australia. Okay, this is what we wanted to talk about today. We wanted to showcase tools that ARDC has been developing for medical researchers that are available now. There are lots of things we have in the pipeline, and we have very big health and medical projects. We'll talk about those in overview, but we wanted to showcase particularly what's available right now, including Research Link Australia and Nectar that I'll be talking about, and Armani is going to be talking about the second half, the health and skills infrastructure. I'm going to be talking a little bit about why ARDC is doing what we're doing, why we're building digital research infrastructure, and Armani, who's part of our skills team, will talk about how you can get trained up in using these resources. So our work at the ARDC is in response to some of the challenges that are playing out in the 21st century for researchers, and particularly the explosion of data that's now available for researchers. Researchers will be well aware that the literature is also exploding, and talk a little bit about how big those explosions are, and the tools and infrastructure we're building to be able to handle that explosion. We're also enabling sharing of data and the facilities you need to be able to share data, recognizing that researchers have struggled with lack of time to learn new things. Grant funding is very competitive, and we're seeing a lot of downward pressure on grants, except for the Medical Research Future Fund, which has been a big new avenue of funding. So just to talk about the data deluge, in this image, the wave is meant to represent all the data that's exploding through because of the internet. And the surfer is meant to represent the researcher. That's you having to deal with this environment with this enormous power. And ARDC is the surfboard. We're the tool that's enabling you to cope with this dangerous environment, dangerous. But once you have the surfboard, you can deal with it. So down the bottom, we've got some stats about how much data is actually available. DataCite is the international organization that creates what are called DOIs, digital object identifiers. These are permanent identifiers connected to a data set, and they have total 185 million data sets. Last year, 21 million new data sets were issued DOIs, and this year alone, 8 million have been created. When I started drafting this slide deck, there were 7 million. I had to update it yesterday, 8 million. So you might be asking, how many of those relate to MND? And if you click on that search link there, we'll take you to the page. So I've got a screenshot of the results. So when we searched at DataCite, those 85 million records for MND, we find that there are 100 data sets, 98 data sets, of which 80 are license ready to use now. So you've got access to look in those 85 million data sets. You can just click here on the search link, and you can open it up and search for whatever you're interested in. And there's an example of a data set about dementia in MND, looking at the MRIs. Australia also has the equivalent of that data discovery portal. We call it Research Data Australia. While the global repository has 85 million, in Australia, we've collected 200,000 data collections, of which one relates to MND. Now, you might ask, why would I want to share data? Why would I want to use somebody else's data? Or here's an example of why we might want to bring data together. In the recent pandemic, there was a massive global data collection exercise of how people were dealing with COVID. So this organization mentioned in the bottom right, the International Severe Acute Respiratory and Emerging Infection Consortium, worked with the World Health Organization to collect data from across the world. I think over 100 countries submitted data to a single data collection that was collected in REDCap at, I think, Cambridge University. So if you click here on the form link, you'll be able to see the form. It's 7 pages long. And they produced monthly reports over how people were treating COVID, how people were presenting, what their symptoms were, what their comorbidity was. So they collected 762,000 patient outcomes. And tragically, 22% of those the outcome was fatalities, and of the people that were transferred to ICU, 36% of people died. You can see the data dashboard, which is a summary of all that data live of the 762,000 patients. This example comes out of another slide deck I did at Swinburne University. You could click on this link here to see that slide deck. Another example of health data being shared is the MIMIC database. That's intensive care data shared from the Massachusetts Institute of Technology, and you can see where it's written up in the journal Nature. So this is impacting the health of communities through exchange of data, collating data, and getting researchers to quickly share how they're approaching a disease. It seems quite relevant to MND. So what is ARDC really about? We're about providing infrastructure to manage and share data. So we want to provide Australian researchers competitive advantage through that data-intensive science. So we want to accelerate research by giving researchers the ability to create, analyze, and retain those data sets and make them available and aware to other people. If you've never heard of the term a data commons, this gives you a bit of an idea of the things that we bring together in a data commons. It's not just data, but it's compute and storage and software. And then we need the people to use it and they need to be trained up. So Arnie is part of our skills team. I'm part of the engagement team, which takes these ideas out to the wider community, specifically the health and medical community. And our emails are on the first slide, so you're welcome to send us any questions about this presentation. So ARDC has a major investment in health research infrastructure, national data infrastructure. ARDC works on a national basis. We call it the People Research Data Commons. And this is what we're trying to do, or these are the major challenges that we're trying to help researchers with. That QR code in the top right corner allows you to register your interest in this particular project, and if you take a photo of that QR code, then you can sign up to get our newsletter about particularly what's going on with the People Data Commons, Research Data Commons. So there are 4 challenges that we're working on. It's only really the first which has researcher-facing services which are available now. That's the FAIR assets, that's making data available and discoverable, and that you'll see in our next slide, the Health Data Australia, that's our service that's available. But we're also working on these 3 other challenges. Secure assets, that means that there's a place that you can work with health and medical data in what we call a trusted research environment. Number 3, data integration is about being able to connect data sets together. So one of the things we're working on in this space is connecting electronic health records across states together. So connecting Queensland, New South Wales, Victoria, hospital records together, and that means standardizing the way we describe that data so that it can be connected together. And we also have a last stream about analytics, particularly applying AI to data. Once you bring data together in a secure environment, then you can run modern AI tools across that. So in sections 2 and 3, we basically have developed framework documents about how those plans are going to work, and we're just starting to do projects in that space. Those projects involved government data. They involve NCRIS partners. That's our sister projects who are building research infrastructure, and you'll see some of those later. And then later on, we're working on disease areas. We're just starting to work on that now, looking at cancer and infectious diseases. And then lastly, health service improvement. But the first researcher-facing tool that has been developed as part of the People Research Data Commons we call Hisanda, and the product is Health Data Australia, which is a repository of clinical trials data or description. So it's fairly new, but we have over 100 clinical trial data descriptions there, and we've worked with a large number of partners, over 70 partners. Armani is going to talk about that a bit later, to develop a way that you can request access to that data. So we work with both data users and data providers. So if you've got a clinical trial, you can share the data description, and then a data user can come to Health Data Australia and request access to that data securely and ethically through the process that's been created in Health Data Australia. Okay, the next tool we wanted to talk about is Research Link Australia. So this is a way of connecting research and industry. So, and when we had a look for MND in our Research Link Australia, that we found 262 MND researchers and 78 grants relating to MND. I stopped counting at $20 million. There's probably substantially more than that. And we've ingested 11 million records into the system, including grants, researcher CVs that are stored at a place called ORCID. That's an international archive of researcher CVs and the publications that they're connected to through an organization called Crossref, which puts the DOIs on publications. So we can have a look at Research Link Australia here. So this is Research Link Australia. And we can search here for MND. And there's our 262 researchers. So we can, for instance, click on Jing Zhao and search for MND. And there's a publication they've made back in 2021 about mediating motor neuron death in MND. So this is a way to find perhaps collaborators in MND, or you can see projects which have been funded about MND. So 300,000 from the NHMRC, 800,000 from the NHMRC, 600,000 from the NHMRC, and so on. $1 million from the NHMRC. And you can find more information. So part of the idea of this is that you can find government organizations and industry organizations that have been included on those grants. So you can find potential industry collaborators. Let's go back to the slideshow. Okay, so also as part of Research Link Australia, we have a number of dashboards which break down. I'll show you the dashboards. So here's the dashboards here. So this shows breakdown of funding by field of research and organization. And then this is the overall. So this has got $15 billion of grants. Then there are some subcategories, including broken down by the national reconstruction categories, including medical science. So you can see within medical science who's getting all the money. CSIRO has 96 grants. WeHi 77 grants. And then you can see the list of grants under here. What this doesn't let you do is search for MND here, but we've also got follow-on projects where we've asked Health and Medical Group to look at how we can enhance Research Link Australia to suit the health and medical community. That's still in development, is not yet available publicly, but there are links on our website about the work they've done. And the last thing I want to talk to is about our Nectar cloud compute facilities. This is a free service. You can sign up for free to test this for 6 months. Basically gives you a cloud compute machine that you have admin rights over it, but you also have to manage it like an IT person. So you need to secure it. It comes with pre-built applications, and the idea is that you can build a platform that you can share with collaborators. It's not currently a secure service, but we're working this year on a secure compute service. This will be the first time that we've offered cloud cloud compute, which is ISO certified as a secure service. And it's also available in Linux and Windows flavors. If you click on this link here, you get a nice little video. This tells you about how big our cloud compute is. We've got 9,000 virtual machines, 150,000 virtual cores, and petabytes of storage. So it's quite a big system. We host a number of services on the system, including some health and medical services, Galaxy Australia for genomics research, Stenformatics for protein research, and National Imaging Facility is one of our sister INCRIS facilities, National Collaborative Research Infrastructure facilities. But I just wanted to show off two of our services, the Jupyter Notebook services and the Binder Hub service. This is a cloud compute service. So I'll just show you Binder Hub first. So what Binder Hub is it's a way of firing up resources in the cloud that link compute, software, and data together. So this is some research I do about the NBN in Australia, and Binder Hub is this little icon here which will open up some cloud compute with this data. So this is the data here, a GeoJSON file. This is 20,000 lines of data. Here's the software, the Jupyter Notebook, and we can combine that all together in the cloud with a click of a button. So we have to sign in to the Nectar service. So we just sign in with a AAF. So I already logged in this morning, so it's taking me straight ahead. So this is creating a new computer in the cloud. And then that's how quickly it's launched. So this is some software in the cloud that I've written with some help. This is analyzing some data in New Zealand. So there's a map. The data hasn't been loaded yet. So this is what's previously been here. So if I just run this, it's saying I can't see any data because I haven't loaded the data. This is the data here. And so these are the files which have been loaded, including data files. So I'm going to load this data file now. Oops, no, I can't load that because I've got to install the software. So this is a software I need to run. So I have to import that software into the machine. That's done. Now I can load the software. Now I can load the data, I mean. So you get this little star while it's loading the data. Okay, it's finished. This tells me how much data it is. There's 21,000 data points, and then I can plot that data. Okay, so this is the data all over New Zealand. Now, what this is telling me is this is data about how fast the internet is in New Zealand. So what I really want to know is I want to color code it by how fast it is. So we've got a line of code here which tells us which can do that. So this takes a little minute to run as it goes through all those 20,000 data points and then assigns a color to it. So it's using a scheme called natural breaks where it decides where it wants to put, where it wants to change the color. So I have a 10-year-old computer at home and it struggles to run this. So one of the benefits of running this in the cloud is that the compute in the cloud is quite fast. Okay, and here's my data visualization. Zoom in. Oh, where's it going? Let's go back. Oops. Anyway, we might stop that there. So that gives you an idea of that's what we're bringing together: compute, software, data all together, and making it available. All right, I'm going to stop sharing now and hand it on to Marnie.
Great, thanks for that, Richard. I'm just going to share my screen. Okay. Not sure if everyone can see that.
Yep, looks good.
You can? Okay, cool. Awesome. Okay, so, sorry about that. Okay, yep, so thanks everyone. Thanks, Richard. So yeah, my name is Amani, as I mentioned before, and I'm the skills development lead for People RDC. So I attend to the skills needs for the health and medical research community. And so what I'll be showcasing in my part of this talk are the more specific health tools and resources that you can use to conduct research, that you can use to conduct your research. And I'll also introduce you to some of the training and resources that we have developed, that you can use in your day-to-day. So today I'll be walking you through the following tools, and keep in mind all the links and the resources, all the links to those resources are in the document that I just sent through in the chat at the start. So feel free to peer through that while I go through this, and also we have the links in the slides as well. So I've handpicked some of the things that we have developed that could be useful to you. And we have many more resources and tools, but today I'll be presenting our Nectar user training and services. So, Richard just showcased the Nectar platform, the Jupyter book, and I'll be walking you through our training offerings and the things that we have developed and the services to support you. And as Richard mentioned before, one of the platforms we have developed is a Health Data Australia platform, and it is a national catalogue of Australian health data. So just think of it as Google, but for clinical trials, but with the added feature of requesting and access to data. And I'll take you through a quick walkthrough of that platform. In the second half of my talk, I'll be showcasing the resources and materials that we have developed in collaboration with various project partners. And these resources were developed to assist researchers when accessing and examining clinical trial secondary data. Because we understand that there are various levels of legalities and jurisdictions and ethics that need to be considered when accessing clinical secondary data. And once that's sorted, there's also that added question of what's the best way to examine this data for impact. So with various project partners, we developed the clinical trials data sharing frameworks, and this includes a series of templates for best practice. And we developed this with the Clinical Trials Impact and Quality Group, or CTIQ. I'll also show you our secondary data use materials, which includes materials that we've developed to guide you through that process of examining clinical secondary data. And finally, I'll introduce you to our resources hub. So we have a main ARDC resources hub on our ARD website where you can access our many curated collections. And we also utilize various platforms to host our many resources, and I'll walk you through those too. So as promised, first thing I'll walk you through is our Nectar Training Hub and the support services that are offered. So we offer online tutorials, which you can take at any time and do at your own pace. And we also offer live online tutorials. And while I'm here, I just wanted to give a quick shout out to our resident Nectar trainer, Marion, who's currently in the audience. I don't know if she could say hi, but if anyone has any Nectar training related questions, feel free to ask in the Q&A session later today. So I've included a QR code here, which should take you through to Nectar Support Center, and I've also included the URL if that's easier. So now I'll just quickly take you through. So can everyone see the website? I'm assuming you can. Yep. Cool. So here we have the Nectar Support Center. And if you scroll down, we'll see we have a search bar where you can search whatever you need to look for. And further down, you'll see that we have these 6 tiles. And this is where you can find various supports, such as, including the contacting the support team and an online chat. And you can also click this little icon to chat with the team as well if you have any questions. We have some support articles that will guide you through Nectar. But what I want to focus on now is just the online tutorials and the live training. So I'll just open that up real quick. Yep, so this online tutorial page takes you to our Nectar tutorial offerings. And as you can see, we have a large range of various tutorials, and they range in difficulty and time, and they're across a lot of different subjects. And you could do these at your own time and within your own pace. So I just wanted to focus on the top row, which are called series, and these are like courses, and they take a little bit longer and a little bit more in depth. And underneath we have these shorter single units, and you can do these at any time. And remember, this is you can access them for free at any time. So just going back to the support center, I'll just take you through to our live training. Oh. 1 second. There we go. Yeah. So yes, so we have previous training offerings that we have done over since the start of this year, and it varies from the oldest here to our most current. And these ones that have already happened, there may be already recordings that you may be able to look, be able to see. And down here we have our more current future training opportunities. And from the list, we have a few upcoming events if you wanted to register for online Nectar training with Marianne, who's our Nectar trainer. And also, if you're wanting to arrange for live Nectar training for your institute, you can fill out an expression of interest form here. But remember, I've also listed all of this information in the resource document that I put through in the chat. So yeah, feel free to have a look at that if you're interested. I'll just go back to the slides. Okay, so next I'm going to take you through the Health Data Australia platform. But before I did, I wanted to give you a little bit more of a technical background about Health Data Australia and how it works. So as Richard mentioned before, so Health Data Australia is a product that was developed out of the HACENDA program at ARDC. And Health Data Australia, as Richard mentioned, it's a data discovery program and a request platform developed by the ARDC. And this was done in partnership with the health research sector with many different collaborators. And the platform was designed to help researchers find, access and reuse health data from Australian research organisations, government agencies and cultural institutions. Now, in terms of the data itself is not stored on HDA. Instead, the platform enables data owners or the data providers or custodians to publish the descriptions of the data, so the metadata. So think of it as a metaphorical tin of beans. So the metadata is the information that is the label of the tin of the beans, with the actual data being the beans themselves. So what Health Data Australia provides is the label, the information about the data set, with the option for you to open the tin and access the metaphorical beans. So on the actual label, or the metadata, besides the information of the data set, there are also information, they provide links to other information, including research contributors, funding, publication, other research and data documentation, such as protocols and data dictionaries and data sharing agreements, and a lot of those, and many other things. So requests to access data are sent through to the data provider, who is responsible for assessing and requesting, responsible for assessing the request and deciding whether data can be shared. And if the request is approved, they will make arrangements for the access to be granted in accordance with their specific governance and data management requirements. And just quickly, at this stage, Health Data Australia contains contributors from 72 health research organisations across Australia, and I've listed all these organisations in the document that I sent round. So now I'll give you all a quick HDA demo, so feel free to scan the QR code or go to the URL if you wanted to see for yourself as well. Here we go. Okay, so here is the platform, and it's simple enough. If you know how to use Google or any other search engine, it should come naturally. This is the landing page, which has some information about Health Data Australia. So I just wanted to draw your attention to these top 3 tabs in the right corner, which provide you more information about HDA, information about how to access the data, and an option to log in. Now, keep in mind, you don't need to be logged in to search for available clinical trial data sets, but if you do get to the stage where you want to request access to data, this is where you need to log in, and I'll discuss that in detail a little more later. So yeah, simple enough. You type in your query and your search, and these are the results. So we currently have 215 data sets on HDA platform, and it's growing every day. We have more and more people contributing to the data set. On the left-hand side, you've got filters that you can use to filter out whatever data set you're interested in. So once you scroll through and you've seen something you're interested in, yeah, just click on it. We'll just click on this one. And then it will take you to more descriptions about the data set. So you have the data title, the data set description, and further down you have this thing called a relationship graph. So it has the name of the data set and the relationships to that data set. So here we have references, so publications, also the group. Sometimes you have another arm here with the creator, so the actual name of the data provider is, or the data custodian. Sometimes you have multiple arms, but this is a relatively simple one. So at the bottom of the page here, we have more of a summary about the data set, and we have more details. So populations, the age, just all those little things. And we also have some information about their data sharing guidelines. Okay, so let's just say you've seen this data set and you want to access the data. You just click this tile, access the data here, and then it will take you to log in. So logging in is pretty simple. All you need is an AAF affiliated email, which if you're affiliated with a university or medical research institute, it's pretty much any email with a .edu.au at the end of it. If you don't have a AAF affiliated email, if you have like a .org, feel free to contact us at the ARDC and we'll see if we can arrange something so you can log on to the portal. So we'll just log in there. There you go, I've already logged in before, so it does come up with your login. So once we've logged in, you'll notice if you look back in this top right-hand corner that a new tab comes up called My HDA. So My HDA is like a profile that it's like an account with HDA where you have where it shows you what your safe searches are, what your submitted data requests. It's just things to keep track. And I'm just going to take a step back a little bit, just go back to that data set. So let's just say we're back at this data set. We're not ready to access the data, but we like this data set. We want to come back to it. You can actually save the details. Yep, save to My HDA. And then when you go to My HDA, then the record saves and you can come back to it later if you like. So let's just say you go back to it and you want to access the data now, you're ready. So what this is here is an expression of interest form. So if you wish to access the data, this is what you need to submit. And it's basically a form which details just certain information about your research project, what you plan on using the data for, if you have ethics approval, what outputs you expect. And it's just a way to, just a simplified way to communicate to the data custodian or data provider what you plan on doing with that data. So once that's submitted, that information is sent directly through to the data provider and they'll review the expression of interest and then make arrangements with you based on your expression of interest. So just going back to the slides, where is it? Ah, there we go. Okay, so there are three things to keep in mind overall is that HDA contains only the descriptions of the data and not the data itself, and that the data is always in control of the data custodian. So it's not a free-for-all. They can choose to share it for whatever reason. And also the data, as Richard mentioned before, the data platform is still relatively new. So we've been up and running for under a year now. And at this point, we're working mainly with clinical trials data, but we're currently expanding into cohorts data. And we're forging some relationships to make that happen. And hopefully that'll happen soon. But regarding clinical trials data, we're always on the lookout for anyone that wishes to collaborate and contribute to the HDA platform. And sharing clinical trials data, as Richard was mentioning before, securely will be so important for the future for improving the quality of research, for funding and publishing purposes, and just generally to be on par with the international data sharing community, which is moving at a very fast pace. So if anyone is interested in contributing or collaborating with us with the HDA platform, I've left some information in the resource document, or you can feel free to contact us at any time. I also wanted to quickly mention there's another research discovery platform called Research Data Australia, and it works very much like HDA. But whereas the Health Data Australia hosts mainly clinical trials data, RDA is a little broader and not so health specific, and not specific to clinical trials, but there is a medical and health science category, so that there may be some relevant material for you. So feel free to explore that if you wish. We also have some guidance document, but because of time, I'll just skip through that. So now I wanted to move on to some of the resources that we've developed alongside various project partners. So we've worked with CTIQ to improve efficiency and quality of clinical research data sharing decisions by Australian researchers, HREX, research governance officers and institutions. So if you're in a position where you want to utilize clinical trial secondary data that you've come across in our platform or any other platform, the outputs from this collaborative project will help you navigate the governance and ethics side of the research project and just generally just to make life easier. So this project is still ongoing, but we've already produced some resources that you might find useful. So the first that I listed was the Informed PICF template, which is a clear participant-centered simplified PCIF. So what we did at the ARDC was assist in developing the wording about future data sharing for use in Australian health and medical research PICFs, this meets the NHMRC requirements, and that template is free and ready to use for anyone. We've also recently released our governance framework, which is essentially a document highlighting the laws and regulations around sharing data and what the fundamental responsibilities for trialists, researchers, ethics communities, etc. And also, just for some light reading, there's a consultation report on the current challenges and practices regarding ethics and governance for approval for data sharing. And I just wanted to flag that we have a couple of activities that will be complete by the end of the year. So we have a HREC benchmarking activity where we're reporting HREC data sharing review outcomes. So they've recruited a whole bunch of ethics committees around Australia to investigate their procedures and their challenges with clinical trial secondary data. And we're also producing a resource toolkit, and these are governance resources where, based on the HREC benchmarking activities, we will develop and publish a practical suite of resources to facilitate secondary data sharing. And these should all be done by mid this year, so in a few months' time. So yeah, watch this space. We have plenty coming up. So now moving on to another project whose outputs might be relevant to you as the secondary data use project. And the aims of this project were to define and communicate the scientific value and use cases of secondary data using clinical data. And what was developed was a practical guide, which outlines a theoretical framework for the use of clinical trials data. And here's a visualization of the framework. And basically what this practical guide entails is to help people who are working with secondary clinical trial data to figure out the type of methodology to use, the type of data sources they need, the steps to required to proceed with the study, and finally, just some examples and case studies that you can draw inspiration from. So we also have complimentary webinars, which was part of this project, and all of this is free and open access, and the links are available in the resource document. So finally, I wanted to showcase all the great ARDC resources that are available free and open access, and you can access these across a variety of ways. So we have our main ARDC resources hub, which is part of our ARDC website and allows you to access our curated collections. And we do have a curated series of resources for clinical trialists. If it's digital training and upskilling you after, we also have Digital Research Skills Australasia, or DRESA, and this is a portal for the discovery of data and digital research training events, materials, providers, and even contact details of trainers if you needed to facilitate some training in your organisation. So basically, DRESA is used to find training all in a single location, to find training by topic and filter out by location and organiser and audience. There's also an option to subscribe to receive alerts for new events, and it also allows you to register your own training. So if you are producing training and you want to make that more visible to the research community, you can log in using your AAF and register your training there too. We also upload all of our webinars, events, and everything in between on our ARDC YouTube channel. And we also have a list of all of our documents in our ARDC Zenodo community, and there are hundreds of resources there, so feel free to explore. So if you have any questions or would like to reach out to us at the ARDC to find out more, here are some contact details. If your query is more HACANDA or health specific, please contact the HACANDA management team. If you have any skills or training related questions, please contact the skilled workforce team. For all other inquiries, please use contact@ARDC email, which will go straight through to Richard and his team, and they will help or triage as necessary. And finally, I'd like to take the opportunity to invite everyone to register your interest with the People Research Data Commons if you want to keep in the loop and be the first to receive updates about activities and events or anything that we're developing with the projects that I mentioned before. And just, I have a few dot points on the side, a little call to action to make your research a little more visible using our tools and resources. So if you don't already, get yourself an ORCID and upload your CV to use RLA, utilise and contribute to HDA and RDA, and together you can use these alongside our resources to conduct literature and data reviews and keep up to date with the latest developments by signing up to our newsletter. And just one last thing, we do have a conference coming up in October if anyone's interested. We've got International Data Week, and this will be held in Brisbane from the 13th to the 16th of October. And if you're interested, go to our website to find out more. And yeah, I'm open to questions.
Hey, thank you so much, Amani and Richard, for your presentation. Got some time for some questions now. If anyone on the floor has questions, there's a little raise hand button at the top of the screen, and just press on that and we can unmute you and enable your camera and allow you to ask your question. You can also type your question into the chat if you'd like. But I might just start us off with a question. This is Richard for you. That database that you showed that had all the research projects that you could search for funded projects for example, MND. Is that only like a government funding like NHMRC, MRFF? And it doesn't include, for example, FightMND grants, like non-government organizations, and how can we work to expand that? Sorry, Richard, you're on mute.
Here we go. Yes, we've ingested some of the large public data sets, including the ARC and the NHMRC. I think we're still waiting to ingest the MRFF grants, but yes, we're happy to take grants that FightMND has made available. It's there. I can just send you a link to our documentation where it's just a matter of formatting your data into the form that fits our database. And then, so we're keen to add more information in there. And you should be able to just click on the about and in the footer, there will be documentation that will show you how to add your records into Research Link Australia. We do have researchers come to us and say, look, I've got 100 publications, but there's only 5 in your system. Can you please add my other 95 publications? But we can't, since we've got something like, I don't know how many researchers, 30,000 researchers in our system, we can't really do it one by one. What we would encourage is to make sure that researchers have all their publications linked into their ORCID, and then we do a single ingest from the ORCID database, and then within ORCID, you can say how much of your information you want to make publicly available. So for instance, you may or may not want to make your email available. So if it's available, then we can ingest it. If it's not available, then we can't.
And just generally, what's like the benefit for researchers to do that, to make their data available on a database such as yours?
So the key benefit is to publicize your work, to find new collaborators who want to work around your data. So when with a data set, there's usually way more opportunity for analysis than people have time. So it allows the data to be used by more people, which can lead to further citations and collaborations. But ideally, it makes science go faster. So more people looking at the same data, see more things and get better results faster. That's the argument that we make to government, and so far they've responded with that. I think the funding envelope started nearly 20 years ago now and has invested billions of dollars into this space to make data available to researchers. And as we've seen, 85 million global data sets now. We're only expecting that to increase, and it increased 25% last year. So when it's 1 million data sets, then we need systems to be able to manage that and ways to be able to find relevant data to each researcher.
Right. Thanks. Got a question from Sikong 2 here. I will just enable his microphone. Oh, sorry. Sikong, you should be able to turn on your mic and camera now. I'm not sure where Sikong's going, but I will, Paul, enable yours. Paul, you should be able to unmute now. If anyone's having problems, you can also just type into the chat and I can read it out. Sorry, we'll just wait for them to type their questions. I think we're having some technical issues with the mics. Sikong and Paul, if you wouldn't mind typing your question into the chat. I just, in the meantime, then a question from Cheyenne No from the University of Queensland. Is there a way to track how often your data is accessed via these platforms?
If the data was hosted on HDA or Health Data Australia and RDA, yes.
Thanks.
I publish a lot of my data on Figshare platform, and if you Google my surname and Figshare, I just ticked over 100,000 viewers on my data sets and something like 36,000 downloads of the data that I do in my type of research. It's not about MND or even health and medical, but it gives me an idea of how many people are looking at it. But I don't know. Since the data I have is open and can be used however people want, I don't know how they use it. But with health and medical data, obviously you need, usually because it's sensitive, you need more ethics approval and explanation about how the data was going to be used before people are given permission to use it.
Great, thanks. Question from Sikong. Is there plans for HSANDA to support prospective cohort studies or primarily completed data sets?
Yes.
Is there capacity to search within data sets to find subgroups of interest as well?
Okay, so with the HSANDA cohorts, yeah, so there's currently in the works as we speak to expand into cohorts and completed data sets. Yeah, that is definitely in the works. In regards to timeline, they are currently working with project partners now to make that a reality. And it is coming to a point where we are forging out plans, and we are hoping to have that delivered by the end of this year, maybe even beginning of next year. So in regards to the second, is there capacity to search within data sets to define subgroups? Oh, that one, you probably can't because you have that data set, but if you do submit a data request, you can stipulate that within the expression of interest, and then the data provider would get in contact with you, and then you can do it that way. So it does provide those contact details for the group and the creator and the data owner, but within HDA, having that further delineated subgroup, you probably can't do that. But in that, on the bottom of that page within that data set, it does have those descriptors there, so you may be able to see exactly what's in that data set. But if you do need more information, just submit that EOI and stipulate that within there, and then the data provider should be able to get in contact with you that way.
Thanks. Paul, I think I have modified your permissions. Could you just give it one more go? Otherwise, you can type your questions to the chat.
I think with the new cohorts expansion of Health Data Australia, they're going to have like a variable browser so that within the cohort study, you can see deeper into
cool.
the questions that are being asked of the cohort. So that's an enhancement to Health Data Australia that's coming, but it's not here yet.
I finally got it.
Yay!
Hi, Paul Tulleman's my name. I'm one of the neurologists who look after MND patients and run the National Registry for Motor Neurone Disease, MIND-Oz. We have two data sets. One legacy data set, which is an aggregation of clinical data over 15 years with 3,600 patients registered, and we've recently re-engineered that database, and it's now under the banner of MIND-Oz and have registered about, we're coming up to 900 patients since over the last 2 years. What we do in those data sets is we collect clinical information on key milestones. So the progression of disease, rating scales of disease, the ALS-FRS score, time to PEG insertion, time to NIV, time to treatment with the riluzole, one of the drugs used in MND. And also we collect clinical data that is based on patient disease phenotype. So we can clinically phenotype a patient into a group, and we know that those groups have progression rates which are very similar. So we can anticipate their course or their median survival times. With a data set like that, we have a governance structure and a governance group that authorises release of the data, and we've recently collaborated with 2 groups in the Netherlands on releasing them the data for their own internal analysis, Enkels and Ruben van Eyck. But I was just wondering how we would approach this, having those data sets available. Data harmonisation is always difficult. How would we sort of investigate the possibility of having this data available in a broader sense?
Yeah, so I think that is a more complicated question to answer within like the next 2 minutes that we have here. But I think
didn't expect you to answer it, but I'm signaling that I'm probably going to contact you.
Yes, I was going to say the best thing to do is to contact us. I'd recommend contacting the Hasanda management team, because we do have our project managers that would be able to tell you exactly, and they'll also have like representatives from Hasanda as well that would be able to liaise with you as well to try and figure out exactly how we would do something like that. But that is something that we would definitely be interested in collaborating with.
Thanks.
Thank you so much.
Fantastic. Thanks, Paul.
If I could add to that, we do work with researchers that collaborate with international colleagues. So an example is the marine scientists. So one of the things the marine scientists have done is they create global standards for data about the ocean, because they don't want to know just about their part of the ocean, they want to know about the whole ocean. So they integrate those data sets together to get a picture of the whole ocean. So we kind of see a time in the future where you work with global colleagues to develop a global standard about how data is collected and then integrated together globally. That's what was done with the COVID work. So one instrument was used to collect data across 100 countries, but it requires community building to work with international colleagues to standardize what you're collecting and way the data can be collated together.
I mean, the effort for MND being a rare disease, so 2 per 100,000 of population, requires a global approach in order to get the numbers to get meaningful data analysis. So if we don't at some stage develop a global approach to sharing data and genomic data, it's going to make discovery even more difficult. And so that is, this is the real, that will accelerate discovery in MND and most rare diseases, is that the data pool needs to be bigger than just a national cohort registry. We need the cohort registries from all around the world being pulled together, and underpinning that is the harmonisation of the data, so that what we're saying here is exactly what they're saying in the UK or Europe indeed.
Yes, I remember our project manager, sorry, I'll just really quickly, they were in talks with Vivly as well, that data sharing, that data discovery portal as well, to see if we could have some harmonisation with the HDA platform. So we are in the works of having conversations with them as well. But yeah, if you send your query to the Hasanda management team, I will make sure that the right people will get in contact with you to see what we can do.
Thank you.
Thank you.
Thanks, Paul. This is great. We would just really want to foster that collaboration, so that's excellent. We do have to wrap things up now, I'm afraid. If you do have anything else you would like to follow with Amini and Richard, you obviously have their contact details, and we're happy to share all those links again so you have access to them. So thank you again for joining us today. We look forward to next month where we'll have another seminar coming soon. But in the meantime, thank you again and have a good week.